Doctors of Reddit, have you ever seen someone outside of work and thought, wow, that person needs to go to the hospital now? What were the symptoms that made you think this? Also a doctor. Couple of times come to mind. 1. Wife wakes up, decides not to go to gym as her stomach hurts, goes back to bed. This is unusual, but I just went about my weekend morning of breakfast and TV. She wakes a couple of hours later, still sore abdomen. Have a look. Tender to touch and percussion. Tapping, not a great sign. Quick pregnancy test, we were trying, which was faintly and it was straight to ED. A few hours later and she's in OT for ruptured ectopic with 1/2 liter of blood in her pelvis. All okay thankfully. 2. This one was quite recent. At my son's group music class, another kid coughing constantly. Sounds like a seal barking. Look at him and he's barely participating. Lying on his grandmother's lap. NWCK muscles straining with every breath. Nasty croup. Grandma actually took a fair bit of convincing that he needed prompt attention. Group is such an butthole. My 6-year-old has had it more times than I can count. Just when we thought he'd grown out of the worst of it, he had his worst attack. 15 minutes from a little breathy to straight out blue. Don't mess with kids and their air. They kinda need it. Obligatory, not a doctor, but my whole family are doctors. Seriously, both my siblings, my mother and my father are doctors. I live abroad, but went home to visit my family over the Christmas holiday and unfortunately had to leave my husband back in the UK. I got off the plane and I felt pretty crappy, but I just chalked it up to motion sickness from the long airplane ride. However, over the next few days I just got worse and worse. I felt really nauseous and exhausted, and I had terrible pain in my stomach. This went on for about a week. My mum was the first one who called it, told me I was definitely pregnant. I completely denied it. I had an IUD and I hadn't missed a period, so in my mind there was no way I could be pregnant. When my mum found out I had an IUD, she forced me to go to emergency immediately. Turned out to be an ectopic pregnancy. Luckily they caught it very early, so no damage to my fallopian tubes or my reproductive future. But yeah, she definitely saved me. If I had waited to go to the doctors after I had returned home, it would have been way too late. So very thankful for my genius mum. I won't be able to see her over the holidays this year. Now I really miss her. I have an IUD and an ectopic pregnancy as my worst nightmare. You have some stubborn oocytes there. For all other girls out there, if you are showing symptoms of pregnancy and you have an IUD, go to the doctor or you could die. When I was 4 years old, my mom realized I was drinking an abnormal amount of water. She had to go to work at that time. She's a doctor, but told my babysitter that if I asked for more water within the next hour to give me warm water. Warm water is disgusting and most children won't drink it. I, of course, asked for more water 5 minutes later and my babysitter told my mom right away. My mom was home within 10 minutes, and I was in the ER 10 minutes later. Excessive thirst is a pretty common sign of high blood sugar and my mom confirmed something was wrong with her hot water trick. I was diagnosed with type 1 diabetes that day. Nurse here was shopping for jeans and noticed a suspicious lesion on the sale assistant's arm. Advise him to get it checked. Go back 2 months later and same dude has giant dressing over his arm protruding out of shirt collar up his neck. Dude hugs me and says thank you, it was a melanoma. Crazy. Slightly off topic, but my mother, trauma surgeon, is the worst person to fly with. So far she has diverted 3 planes for people having in-flight medical issues and the plane not having enough the right supplies for the flight to keep going. She once got in an argument with the pilot about whether or not the patient was sick enough to cause a diversion. Also, she was many years ago, she was at a high school football game. Kid broke his arm and had no pulse in his wrist, meaning the blood flow to his hand was cut off. She field set the bone to restore blood flow, then put him in the ambulance. Then she went back to her seat to watch the rest of the game. Your mom is a boss. I'm in school now to become a physician assistant. One of our professors was telling us a story about his time in med school. They have actors come in to be patients for exams. I forget what the particular scenario was, but the patient had pretty significant edema that became visible in the exam. Our prof goes, "Do not do this during your examinations. I'm serious. Do not do this." What I did next was I turned to the camera. I said, "This is not part of my examination." He turned to the actor and said, "Are you seeing someone about the edema in your legs?" Actor, "No. Prof, okay. You are to not have any salty foods until you do. After this exam, I want you to call your doctor. Tell him or her you need to see them tomorrow. Okay?" Actor, "Okay. Professor." Turns to camera, "Okay, I'm resuming my examination." He passed. Not me but my dad, who's been an anesthetist for many years now. He used to operate before monitors were common in the less developed parts of the world, and so used to monitor a patient's heartbeat by checking the pulse on patients' wrists. Over time he developed a habit from this, and when he handshakes anyone, his 2 fingers immediately go to the person's pulse. Once he meets an acquaintance in the street, sensed from the handshake that something was wrong and told him to go to the hospital ASAP because he had atrial fibrillation. That's like a superpower. I'm a nurse. When I first started working, I would see a patient and think, oh wow, this person really needs to go to the hospital and needs a nurse. Then I realized that's me and I panicked for a while. I had the same experience as an EMT. Someone should call 911. Oh crap, I am 911. Graveyard RN here. One day after I woke up, my husband said someone in our World of Warcraft guild was asking if anyone was a doctor or a nurse. So I logged on and talked to our guildie, who was having classic appendicitis symptoms, and I told him I thought he might have a hot appy. Didn't see him online for almost 24 hours. When he came back on, I asked how he was feeling. He said he was logging in from the hospital and had his appendix removed. I was glad I could help. I'm a psychologist in training with a specialty in developmental disabilities. It's always tough when I'm in a social situation and see a kid showing clear signs of autism, since early support can make a big difference. But it's very risky to even raise the possibility of such a huge bombshell outside of a professional setting. Also, an actual doc had a janitor who I was friendly with stop by to shoot the crap. Just small talk sort of stuff. He says, "I've been doing great but my left leg's killing me. For whatever reason." I say, "Is it swollen?" "No idea why. There are a million reasons for leg pain. It just came to me and of course it is. Right leg's normal. I think you have a DVT. You need to go get that checked, like today." He, being a typical male, and I can say that because I do dumb crap all the time too, says, "No, I'll just tough it out." Long story short, had to go to his boss to get them to get him to go to the hospital. Clearly had a DVT and if I recall correctly had some small pays. Super nice guy. Did fine. Your response is pretty cool, but I don't know what any of your acronyms mean. My cousin is a nurse and I wanted a second opinion on my tit. After seeing my doctor the previous day, I sent a photo of my tit and my cousin replied hospital. Now, I had mastitis turn abscess from breastfeeding. It was the worst case anyone at my hospital had seen. Heck, they had doctors, nurses and students all coming in to see my tit. By the time I had surgery, this infection was protruding and filled with blood and pus. It went from red and swollen to pus and blood within 6 hours. It was huge. After surgery they stuffed my boob with 5 feet of gauze. It was removed by one nurse who had zero clue I had no painkillers in my system at the moment. I bawled and screamed in the shower as she ripped it all out. She apologized after realizing I felt every bit of that gauze coming out. Worst experience of my life hands down. I had to have a nurse come daily and change my packing and bandages for 6 weeks because the gaping hole almost made me pass out after the gauze removal. In a hoe. Thank God my cousin told me to go. This made me cringe so hard. Glad you're okay now and so sorry you had to go through that. How the frick did your doctor not notice something that serious? Ugh. I had a friend call me to ask my advice. A mutual friend of ours was pregnant and at 35 weeks. They were all out to dinner and about to go see a movie when this mutual friend had mentioned she hadn't felt the baby move in about 10 hours. So my friend called to ask if they should call her doctor. I'm not a doctor, just someone who has been pregnant before. But even I knew that was bad news bears. I told them to forego calling the doctor, just go to L&D to get monitored ASAP. They got her there and they found the baby very low amniotic fluid and the blood oxygen levels were so low that the doctors were surprised the baby was still alive. Emergency C-section and baby and mom were fine. Still scares me to think that if they hadn't called or she never spoke up, what could have happened. My grandfather was walking up a hill and got a bit winded, more so than usual. He's diabetic, so thought it may be related and played it off as if it was nothing. A week goes by and he's still complaining. Feels a constant pain in his chest and shortness of breath. Finally he decoded to see the doctor, who takes one look at him and tells him to go across the street to the hospital. An EKG and a couple tests later, it turns out he had a heart attack and needed quadruple bypass. Were it up to him, he'd never have even gone to the doctor in the first place. Not a doctor, but my father went in for an abdominal hernia surgery and was going to put under general anesthesia. He gets put under and before he knows it he's back. The surgeon and anesthesiologist both tell him that they couldn't complete the procedure because he went into atrial fibrillation, AFib, and should go see his cardiologist. Cardiologist ran some tests and suggests having an angiogram done. Turns out he had a 90% blockage in one artery and a 99% blockage in another, so it was time for him to join the Zipper Club with a double bypass surgery. TLDR. An aborted abdominal hernia correction procedure enabled my father to avoid a heart attack, probably saving his life. Just to clear some things up, my father was able to walk out of the hospital after said aborted hernia procedure. I even picked him up. Second, it took about a month of tests to finally get to the angiogram, which was scheduled after he had a stress test done. Third, he was seeing knee-associated cardiologist weekly and was put on heavy blood thinners and ordered to rest. Now I don't remember every test that was done, but that pretty much sums everything up. My father has however since switched cardiologists at the behest of the former cardiologist to someone associated with the Cleveland Clinic who is a specialist in atrial fibrillation. Not a doctor, but I am a medical student. Final year. One day I was out in the city and I saw a man collapsed under this busy bridge. At first I thought it was just a drunk homeless man passed out, but as I got closer it was clear that his whole body was jerking. Looked a lot like a tonic-clonic seizure, characteristic of epilepsy but could be other things. He'd hit his head pretty hard and nobody was helping, so I went and moved his legs out of the road. Tried to get him on his side act. Called an ambulance and eventually the guy stops seizing. Wakes up confused and exhausted, which is not uncommon. Ambulance arrives. Dude says he's never had a seizure before. His head is bleeding and he just straight up refuses to get in the ambulance, despite the paramedics trying their hardest to convince him. All new seizures need to be investigated. Could be anything from a brain tumor to alcohol withdrawal, but nope. He didn't care. Wonder what happened to him in the end. This was in the UK, so he definitely wasn't refusing help because of financial reasons. Years ago I had a really bad virus of some kind. I was coughing so bad that I was literally peeing myself. I had diaper pads under and mattress protector because I could not hold anything, I was coughing so hard. At one point I heard a snap and I felt what I thought was my rib break. I got out of bed and headed for the nearest at like 2 AM. They called it atypical bronchitis and sent me home with antibiotics. Didn't do x-rays on the ribs at all. Week later I was no better. In fact I was worse. During my illness some people moved in next door. The guy in the apartment next to me was a pediatrician and he heard me coughing. He came over and took one look at me and the next thing you know I was in his office and he was checking things out. I didn't have bronchitis. I had whooping cough and that doctor next door, he probably saved my life. I had cracked 2 ribs at that point. It was that bad. A month later I get a huge bill from the ER. He went over there and basically got it dismissed on the basis of malpractice. He was just furious with them. Not only did they freak up and get it wrong, they had the gall bill like $2,000 for doing it. Thing is, this was going around and by law it had to be reported, so he had good reason to be upset. Me too. They nearly killed me by not getting it right, but they also put a lot of people in jeopardy by not taking action early on. Note, even if you had shots, don't assume you are protected. I'd had them, plus boosters. They didn't take. 1% of shots for that don't take. 1 in 100 is at risk. Freaking vaccinate your children. People die from that. Doctor here. A few family friends have died in the past few days and I've spent more time answering questions from relatives about what exactly heart failure is, etc. When it comes to spotting medical problems directly, I've been lucky so far, but you do tend to stick to the stock advice of see a doctor who isn't me. Dad's foot has swollen up with a huge infection. He needs to go to the hospital, pretty sure that's gout, but you need to see the GP tomorrow. It was gout. What do you make of this boob lump? Pretty sure that's a cyst, but get yourself to a surgeon in the next 48 hours. It was a cyst. My testicle is swollen and really sore and I'm freaking out cause Google said I'm gonna need surgery. Hold on, I'll send you a photo. 95% sure I'll get arrested if you send me a photo of your preteen junk. It's probably orchiditis or a bruise or something, but get mum to take you to the GP like right now. Weirdly that one was epididymitis. I'm not a doctor, but I know a family who was at a park one day. A doctor walked up to the parents and said, "Is that your son?" while pointing at their child. When they said yes, he responded, "I'm a doctor. You should take your son to the hospital immediately. The shape of his abdomen and the way he is walking looks like he may be very ill." They decided to follow the random doctor's advice and took their son to the hospital. As it turned out, he had cancer. Thankfully, he is now healthy and in remission. But without that one doctor, he may not be here today. Thank God for doctors. Dental assistant here. One of my teachers quietly approached her friend at a dinner party and asked if she could palpate that lump on his neck. It turned out to be very aggressive cancer that took a lot of his neck and jaw, but he lived. Turns out, the guy hadn't been to the doctor in a decade, but was religiously going to his dentist every 3 months. However, his dentist chose not to do head and neck exams, which used to be considered an essential thing in dentistry. My teacher used the story to emphasize that dental assistants are more than the people holding the saliva sucker in your mouth. We know a whole lot about the head and neck, so let us feel your lymph nodes if we ask. Let us shine the cancer detector down your throat if we ask. And if you feel something weird on your neck, but aren't able to get to a doctor, see if your dental team will palpate it. We're strange people. We will palpate your lumps. Happened yesterday. I heard a clerk at a gas station saying he fainted 3 times that day. Turns out he was on spinal chemo and antibiotics for infection. Bunch of different things could have caused the fainting, but several possibilities were serious, and at his age he was one bad fall away from something serious anyway. Told him to get a buddy to pick him up and take him to the hospital. I got my rectum and colon checked, aka colonoscopy, at 25 because of a medical student said he thought I might have a rare disease. Context: met him Dr. A at a concert through a friend who was also a medical student. Dr. A hesitantly asked if colon issues run in my family. Tell him I think so. Why? Proceeds to say there is a rare disease of colon and rectum issues and symptoms can be freckles on the lips, of which I have. He highly suggests I get a check because it could be life-threatening. Tell my wife, and few days later I'm sitting amongst 50 years olds who all know where we've been the last 12 hours. The rectum scanning doctor was very lovely and ended up complimenting my colon and rectum, saying it's one of the best she's seen. TLDR, met acquaintance at concert, who's a med student, thinks I have a rare life-threatening disease. Get colonoscopy. Nothing but, pun intended, cleanest rectum colon doctor has ever seen. I had a friend with Peutz-Jeghers syndrome. He had the cutest freckled lips you've ever seen, which didn't seem too strange because he had freckles everywhere else, too. He had red hair, grey eyes and eyelashes with white blonde tips. He died from cancer at age 36. That student was right to be concerned. Good on you for listening. Nurse here. Found a weird mole on my mom's back. We have a strong family history of melanoma, so I'm super cautious with anything abnormal of the skin. I kept pushing her to get it checked out. Goes to dermatologist and the dermatologist says it's nothing to worry about and that she didn't want to biopsy it. My mom told her to go ahead and biopsy it. Ended up being precancerous. I can't imagine my life without my mom. Thank God we got that one taken care of. No, not every mole is precancerous. For a mole to be precancerous, they look at it under a microscope and determine its degree of abnormality. If it meets the criteria, for example, cell shape, size, shape, etc., it is not yet at the stage to be classified as melanoma. It is determined as in situ, basically meaning it is abnormal but not enough to be considered melanoma yet, therefore leading to the term precancerous. Harmless and harmful moles are almost indistinguishable to the eye pretty often. I'm surprised the dermatologist wasn't gonna err on the side of caution. Nurse here. Family friend said his throat was really sore for the last few days. Asked him what else had changed. He said everything tasted kind of metallic. Took a look in his throat and told him to get into the doctor ASAP. He had severe throat cancer but is doing great now. Pretty much the opposite to what you are asking, but my wife went over her ankle wearing heels last year. I convinced her to not go to the ED for 3 weeks before finally taking her. I was making fun of her being a hypochondriac the whole time. Turns out she had a fractured metatarsal. I am an ED doctor. We went to the department I now work at permanently. I will never live this down. Guy had fallen and cut his head. You know how heads bleed badly from even a tiny cut? Well, the thing that struck me was that he wasn't bleeding from this gouge in his head from hitting the pavement when he fell. I thought this was a little odd. Turned out his heart had stopped. He lived, with the addition of an internal pacemaker. Ribs really do crunch when you do chest compressions. Of course, I'm not a doctor. My buddy had this happen to him. Owned an art gallery, having a big opening. A local MD took one look at him and said something along the lines of, check yourself into a hospital now or you will die. He's waiting on a liver transplant now. My father is a doctor, and while this happened in his office it was outside of his regular specialty. So, he's an allergist. One day a patient comes in, gets his shot, and everything is fine. My father asks him if anything else is bothering him or how things have been lately, and the guy shows him a small cut on his thumb. My father takes one look at it and says you need to go to the ear now. He actually said not to even pay the receptionist on his way out. Just go to the ear. Flesh-eating bacteria. Nasty stuff. The guy came back a week or 2 later after he had been successfully treated and thanked my father. Somewhat related story. Me and my wife went to Italy on our honeymoon. We parked the rental car, hiked for an hour or 2 and took a small train back to our car. The sun was really hot. And stupidly enough all we had to drink the entire trip was a beer each. The train reaches our stop and we get up. Now, my wife is a small lady, being dehydrated from the trip, sitting down in a cool train for a few minutes and then suddenly standing up. She looks at me, mutters, "This isn't going to work," and collapses like a bag of potatoes on the train floor. I panic. The doors only stay open for a few seconds, and we need to get off at this stop. I do the only thing I can think of. I pick her up and carry her dramatically out the doors. When I put her down she is slowly coming to and starts vomiting all over the ground. I look up and there's a concerned crowd gathering around, asking if we need help, if they should call somebody. It's okay. I'm a doctor, I say, for the first and probably last time in my life. Suddenly, everyone gathered sigh with relief and smile as they disperse, wishing us good luck. All that's going through my mind is, holy crap, I hope I'm right that she's just dehydrated. If she dies because I refused help she'll kill me. She survived. But I learned several lessons that day. If you're a doctor, people will assume you have a medical emergency under control. You really shouldn't be the one treating friends or family members if you can help it. And, it is way easier to pick up women if they're unconscious and your train is about to leave. I'm sorry but I giggled when she said, "This isn't going to work." I'm so glad she was okay, but it's funny how our brains process things when things aren't going right. MD here. Psychiatrist. I see people that need help non-stop. Drunks at the bar. Psychotic homeless. Addicts of all shapes and habits. If someone looks bad enough, I stop and see if they'll head to the nearest ER. No one listens. Doctors of Reddit. What is the most weird thing a patient has tried to convince you about? Pediatrician here. On mobile. English is not my first language, etc. When I was in my residency we had a little girl, 7 or 8 years old, who was admitted for a supposed psychiatric breakout. She was on antipsychotic drugs as outpatient. The mother said that she had a lot of psychiatric trays and conducts etc, which we found odd because she was a quiet and sweet child. We started weaning her off the medication and she was the sweetest child imaginable. Turns out the mother had been making up the symptoms, even managed to fool mental health professionals before we met the patient. Subsequently things got judicialized. They lost custody and last time we heard of her the girl was doing well. This is a condition called medical abuse by proxy, formerly known as Munchausen syndrome, where basically the people who have it crave the attention a fabricated disease gives them. Oh wow, as an adult who takes an antipsychotic and has trouble with the side effects, I cannot imagine how awful it must have been for that little girl. She must have felt so lost with everyone telling her she was ill and not knowing why. I was an EMT, not a doctor, but we got a call for a woman who felt dizzy and weak. This was in the middle of the summer. She had horses she cared for and spent all day out in the field. She was severely dehydrated and we asked her how much water she had drank so far that day. She said none, but she had 6 cups of coffee. This was around 12:01 p.m. We tried to explain to her why she needs to drink water, but she wouldn't listen. She said she only likes to drink black coffee. She kept trying to blame her feeling weak and dizzy on some BBQ she had eaten. This went on for about 15-20 minutes. In that time she drank half a glass of water. We got an AMA signature from her and left since she didn't want to go to the hospital and there was nothing else we could do. It became a running joke at the squad station. If anyone ever felt sick, we would blame it on BBQ. It's still shocking to me how many people refuse to drink water. My brother works at a lumber mill and says that he's never seen 2/3 of his co-workers drink anything other than soda. They also complain about how crappy they feel on a regular basis. Emergency department doctor here. I once had a young male patient walk in, after sitting comfortably in the waiting room for over an hour, with no obvious injuries but complaining of severe leg pain that just started for no reason. He then told me that he was allergic to everything except IV morphine and ketamine. My eyebrows obviously went up because he spent the next 5 minutes desperately trying to convince me about these allergies before giving up and walking out of the department, with no pain whatsoever. Later found out that he's tried this in multiple nearby departments. We would have those patients come in and after some appearance of thoughtful consideration, we'd tell them we'd give them a powerful painkiller called Dolabid. We would intentionally mispronounce it to rhyme with Dilaudid. After an hour, these people would look like they were higher than a kite. Dilaudid is a powerful narcotic. Dolabid is an NSAID like Advil. I am not a doctor but have a friend who is an emergency medicine doctor. Hopefully I can do this story right because it is absolutely hilarious. So my friend had only a few hours left in his shift when a young man came in with his older mother or grandmother. He came in complaining he had something up his bum and could not get it out. My friend finally got him to answer what it was, and it was a summer sausage his mother got for Christmas. He gives him some pain meds and begins to try and remove it. He tried with one hand but he couldn't get his fingers around it and kept on sliding further up his anus. Then he tried using 2 hands and was trying to receive this sausage like a quarterback would from a center. He said the whole time the dude was moaning and couldn't tell if he was enjoying it or was in pain. The whole time the sausage keeps sliding out of his hands and further up this guy's butt when the nurse with him starts yelling gloves. My friend had his hands so deep in this dude's butt he was about to go past the point his gloves cover his hands. He then decides to use forceps you'd use for retrieving objects out of someone's throat. He finally gets a hold of it from the front of the sausage and finally pulled it out. My friend was so relieved he could finally be done with this nightmare until he looks down and red fluid is leaking out of this man's butt. He assumed he must have punctured his rectum, but here if you leave a summer sausage in your butt that has a red casing for hours, it basically makes a gravy of disgustingness. His relief was already there for him and he finished up with the sausage man and left. He later received pictures from nurses with the sausage wrapped like a baby held by the nurses there with a weight and everything, and for several years after that would receive them in the mail or find them on his desk. That's the worst thing I've read all day. Not a doctor, but I work in an emergency room as a scribe, so I follow doctors around. One day, an ambulance brought this guy in straight from dialysis because he had become super mentally altered. He was just swaying his head back and forth and would only answer yes to every question. What year is it? Yes. After a couple hours, his wife showed up, and his toxicology screen results were ready some time after that. Lo and behold, he was on C. The doc asked the wife to leave the room and confronted him about the results. Guess what? He snapped out of his altered state and immediately tried to convince the doc to lie to his wife about the C. I've never seen someone beg like this before, especially after hours of only saying yes. The doctor essentially said tough crap, and that she wouldn't lie for somebody that wasted hours of her time. Another one. We had a patient in the ER being detained by the police. The problem was the patient was unresponsive. The attending walked over, picked up the patient's limp arm and held the hand over the patient's face and dropped it. His hand completely missed his face and fell to the bed beside him. A truly unconscious patient will not protect their face. He was immediately discharged to police custody and he walked out on his own. That they are allergic to every oral formulation of pain medication. That the natural treatment they just read about online while waiting to see me is better than anything I might offer. I can only do nasal pain medication. Proceeds to do a fat bong rip. A long time ago, I was convinced that tiny, bluish black parasites were feeding and living on my skin. I collected these buggers in a small jar, took them with me to the doctor. The doctor looked at them for half a second and told me it was lint. Okay, that made me laugh. For once the tiny bugs living on my skin were not psychosis. Dentist here. A patient once tried to convince me that he was being hunted by government agencies because of the information he had acquired over the years. That was placing a negative energy around and within himself which was causing his teeth to rot. This wasn't some crappy dental office either, it was in one of the most affluent neighborhoods of Chicago. Sounds like your patient was schizophrenic. Not a doctor but worked in an ER as part of the initial treatment team. Patient had taken a pair of wired iPhone earbuds and stuck the plug end into his urethra, all the way up to where the cord splits into 2 wires for each earpiece. Said he passed out at a party, woke up to find it there and that his friends had done it to him while he was passed out. They couldn't be pulled out, had to have surgery to remove it. Why? What happens when you put those same headphones in your pocket and walk around for hours? They get tangled up to holy heck. The doctor I was with had seen this same guy a few weeks prior for the same thing but with a wire coat hanger. We managed to get him an appointment with a mental health professional shortly after. Had a friend who was an X-ray tech. She would have all the stories of how to position folk in their coat hangers. Not a doctor but when I was in the waiting room of the ER, this elderly woman tried to convince the front desk that she broke 2-3 ribs. She kept laughing and chuckling with the doctors while talking to the doctors. I was in more pain with suspected appendicitis than she was. Safe to say she was fine and was discharged within 2 hours. Oh god, I broke 4 ribs about a year ago. Fell and landed hard on my left side on concrete steps. I couldn't breathe. I couldn't move. I couldn't have laughed if Stephen Fry had shown up in person. Getting into and out of the car was almost impossible and left my shaking, sweating and crying. It was awful. My wife just spent a year as a PA at an urgent care in an undereducated area. The amount of stories she has are in the thousands. One of my favorites is, I can't have COVID. Holds up Taco Bell bag. I just ate all these tacos. I don't know anyone with COVID that can eat all these tacos. Also, my daughter's friend's mom called me and told me her daughter has chlamydia and that everyone her daughter has been with needs to be told. So I'm brining in my daughter because they were in the same car together. My wife had to explain to him how STDs work. Lastly, I have the sugars. That's it. From now on I'm not drinking no more soda. From now on it's only Gatorade. That was a response to being told he has diabetes. The sugars. Love it. My Alabama grandma used to say this all the time. It's why I call trembling the shaky shakes as a full-on adult. Not a doctor but an old co-worker of mine was a drug addict and cut his forearm open on a chomp saw. He tried to convince everyone before he got pumped full of drugs by the EMTs that the top of the saw was broken off. It wasn't. And he was throwing wood over the top of it. He wasn't. And caught his forearm on top. Chomp saw. New favorite tool. A lady was trying to convince me she was having a stroke because she couldn't move her right arm. The only problem was that she demonstrated this by repeatedly shaking her right arm in my face saying, "See, I can't move it." I work for an attorney and we had a client come in once telling us he had paralysis of his left arm and leg as a result of the car accident he was in. He walked in on his own and spent the entire conversation flinging his arms around, gesturing with every word. About once a year the same person, from a different continent, emails my team claiming that exposure to bat droppings has left her with intense diarrhea, spontaneous orgasms and an allergy to pears. Not a doc, just kinda related. I had a patient try to convince me that he occasionally grew feathers from his head. I asked him if he had a down pillow or comforter. He said yes, but didn't get the correlation. Anesthesiology interventional pain specialist here. When I was a resident, my attending used to prescribe opioids, but back then, patients needed to sign prescription contracts and get regular urine drug testing done at the office. One lady showed up for a scheduled urine drug screen wearing an adult diaper, nonchalantly acting like she lost control of her bowels and didn't seek any medical intervention, clearly in an effort to not give a sample. Just casually wearing a diaper. Upon further questioning, even challenged us to check her diaper for excrement, which she assured us she was depositing in her diaper during the entire encounter. We referred her emergently to the for urgent neurosurgical eval because loss of bowel and bladder control could be a huge deal and indicate major spine injury. She declined and walked to the corner bus stop with a diaper full of crap and pee. Patient tried to convince me with very strong conviction, in full sentences of perfect English, that she didn't speak any English. She was convinced she was speaking a dead language that only her, me, and God could understand. I knew this comment section would be filled with stories about people shoving items in their holes. I came here to read what items they are and imagine how they did it. I too came here for the guess what's in my butthole stories. They're always hilarious in one way or another. So the patient is me in this case. Last week, as I was getting a dog toy from under the bed, my dog jumped off right as I was picking my head up. She landed with her paws on the back of my head and her claw sliced the back of my ear and tore open my earlobe. This created a pretty nasty laceration. I went to the ear and needed a number of stitches. It should have been simple, except no one believed me. 2 doctors and 2 nurse practitioners weren't convinced that this is how I received the injury. Even my dad was less than fully convinced at first. It truly was just a freak accident. Wrong place, wrong time. Still, nobody believed me. Psychologist here. I work psychiatric inpatient, so you can imagine the gamut of things patients try to convince me of daily. My personal favorites have been that they are pregnant with 99 fish babies, that they are actually a Supreme Court judge and king of Jupiter, and that there are angels in their urine sample so they need to do another one. I have so many more, but those are the most recent ones that come to mind. I'm posting on here a second time because more examples are coming to mind. Every patient ever has the most severe form of whatever diagnosis. The doctor said it's the worst fracture he's ever seen. I have end-stage fibromyalgia. I almost died from my pneumonia that was treated as an outpatient with antibiotics and no oxygen. Always have to tread carefully with how approach those subjects, cause people will defend it to the death. Have a friend that's an OBGYN. She once had a patient claim that they were pregnant with a crypto pregnancy, which is apparently when people are convinced they are pregnant based on how they feel, I guess, despite all tests showing they are not in fact pregnant. It will probably not shock you that the patient had been through several doctors. Oh man, there's so much of that on obscure internet message boards. I went down the rabbit hole one day and found a crypto pregnancy support group. It was really crazy but sad at the same time. A guy once had pain in his belly and the doc told him to lift his arms and a TV remote just fell out. He was so fat it got stuck between his wrinkles. I volunteer at an STI clinic, not a doctor, and we always ask people if there's a reason why they came to get tested. I have heard so many misconceptions, but one of the more uncomfortable ones was that a young lady said her boyfriend insisted he got chlamydia from sharing a towel at the gym and that she should get tested just in case. I kindly explained to her how chlamydia is transmitted and gave her some brochures to take home with her and share with her boyfriend to discuss. I'm not a doctor, but a classmate was trying to convince the class that she had holes in her lungs. I mean, she's not wrong. It's really common for people to claim that they in fact have a fever despite not having a fever, because they are a low temperature person. Also, a woman claimed her uterus had wandered. I'm not a doc, but I'd order an ultrasound just to see where her uterus had wandered to. I wouldn't even disbelieve the patient to her face. Oh look, it came back. Dentist here. Many patients try to find excuses for their very poor mouth hygiene, and many try to convince me that it was because of an accident, when it is obviously not. Not a doctor, but I was in a very crowded emerg with my wife. Waiting, nothing too serious. A giant dude in a muumuu was approached by a doctor. The patient was a frequent flyer was my guess. Doctor asked him what was going on. He begins with, I was diagnosed a lesbian. My landlord keeps me penniless. She comes into my place and takes my money. I'm taking estrogen but keep forgetting to take the pills. My daughter, she's in Buffalo. She comes to see me sometimes but she's busy. 6 minutes later the doctor says okay, what did you come to the hospital for? What is it you want? I hit my head and I need stronger pain medicine than Advil. The doctor walked off. I don't know if he got a script or not. Not a doctor but I'm 12 and was in the hospital cause I went into diabetic ketoacidosis. Google it if you don't know what I'm talking about. And the one nurse said that since I have diabetes I can only drink like diet sodas and stuff that don't have sugar or carbs, and my dad tried to tell her that aspartame, an artificial sweetener, causes leukemia lol. On the other hand, have you ever had a pain or issue that seems so weird or hard to describe that the doctors look at you as if you're having a laugh or making it up? When I'm in pain, especially if I have had even a cocodamol, I can't describe things to make reasonable sense at all, and it always results in a yeah right look from the doctors, at least to start. Not a doctor, but worked in a hospital. I can't drink water, it makes me gag. Really whiny, needy person came in constantly complaining and wanting someone to listen to her talk about every painful experience of her life. Her BF ditched her as soon as she was in a hospital gown, and since she couldn't stand up for a while after the procedure, she kept insisting he had her coffee that she needed and we had to go searching for him. We offered alternatives, but water makes me gag. My best friend can't drink still water. She has PTSD from severe nausea and vomiting during pregnancy and it really does make her gag. I don't know how she survives. She drinks sparkling water and I guess that's enough. Not a doctor but this guy tried to lie for a prescription for anxiety meds. He told the doctor he had frequent urination to warrant a checkup. He ends up getting a full-on prostate exam and gives a blood test. The guy faints upon being pricked with the needle, passing out long enough for the doctor to clock out. The guy did not get a prescription for anxiety meds. John Mulaney. Doctors overdid it. What's something someone came to the hospital for that they thought wasn't a big deal but turned out to be much worse? Had a guy come in complaining of a cough and difficulty swallowing. He thought he had tonsillitis and just wanted some antibiotics. I noticed his voice was incredibly hoarse but there were no swollen tonsils, so sent him for a chest x-ray. Huge, baseball-sized tumors all throughout his lungs. One of them was pressing on the recurrent laryngeal nerve, causing his speaking and swallowing problems. He died within a week. Well, this thread is terrifying. My best friend's sister went to the hospital for what she thought was a lingering flu. She walked out with a diagnosis of bowel, stomach and liver cancer and died 9 months later. My dad went into the hospital in some pain. Back when he used to power lift, a nurse comes into the room, looks down at her chart, looks back up and says, "Mr. Pickle, you are having a heart attack." He got up on the bed and flexed, saying, "Does this look like a man that's having a heart attack to you?" She looked back down at her chart, up again, and says, "Yes. Sir, this is a no flex zone." Not a doctor, I'm an EMT, but when I was deployed to Afghanistan as a medic, a medevac pilot came in because he had a small abnormality on his flight physical EKG. Apparently this was something he had been getting waivers for years for. I had just finished an A&P class and learned about something called Brugada syndrome, which is basically an arrhythmia that causes sudden cardiac death in the patient. I jokingly mentioned how his EKG reminded me of the abnormality I saw in my textbook, thinking there was no way he actually had it and it had to be artifact from the EKG. The doctor's eyes widened and he sprinted out of the office. The pilot had it, was immediately relieved of flight duty, sent home and had a defibrillator put into his heart before being medically retired. TLDR, I accidentally diagnosed a man with certain death. Good for you, you saved his life. My sister-in-law thought she had a cyst on her shoulder. Nope, round cell sarcoma. The doctors said she had 2 months. She lived for 8. When I was doing my hospital placements, a patient came in laughing and skipping for their scan. They thought 100% they were in remission and clear of cancer growth. I was spending a day with the scan techs and sat in. The scan didn't show one tumor, it showed hundreds. The guy was riddled with metastases. It was terminal. He had months. He was laughing and smiling with us. He asked if we could tell him how it went, and the tech said we couldn't. It was for the doctor. The old man winked at us and walked out. He was so happy. It was one of the days that told me I couldn't do that job. My mother woke up one day and her arm was numb. After about 45 minutes it was still pretty numb and she thought she had pinched a nerve in it sleeping, but went to the ER just in case. She had a stroke, which actually was caused by a blood clot, which moved up from her heart and exited a hole in her heart. A congenital defect she was unaware she had. She ended up fine and feeling and her arm came back, but she was incredibly lucky that it did. When I was 12 I had a crazy bad headache that wouldn't go away. My dad brought me to the doc and I didn't even make it to the exam room before they turned me back and sent us to the hospital. It turns out my headache was from a burst sinus cavity, as in all the bones around my eye broke and the liquid leaked back onto my brain giving me brain meningitis. My eye was bulging out to the point where I looked like an alien and they told my parents I was not going to make it. Obviously I pulled through but was hospitalized for 2 weeks and missed 2 months of school. I was at the time only the third known case of this happening and they had flown in doctors from all over the US and from the UK. Crazy stuff. I thought it was just the worst headache. Turned out to be so much more. The 7th of December, 2012. We brought my father-in-law to the ER because he just wasn't acting right, mixing words, feeling tired. My husband and I thought for sure he had a mild stroke. The ER staff thought he had a stroke too, because of his symptoms and he was 79. They did a scan and nope, cancer. 3 huge tumors in his brain. We took him for more tests the next day and it was lung cancer. A tiny spot in his lung that traveled to his brain. He died 13 days later, on my husband's birthday. I'm a nurse. I cared for a patient that came in because she woke up with a severe headache and a knot on her head. She went to CT for a head scan and had 2 bullets in her head. One had gone in at the top of her head, just past her hairline and traveled under the skin, but on top of her skull to the back of her head. The other went straight in, it just fractured the skull behind her ear, didn't go all the way through the skull. They were smaller caliber bullets, apparently. She went to sleep the night before after taking an Ambien and there was a drive-by shooting on her street. The bullets went through her window and she slept right through it. Note to self, never take Ambien, you will go into a freaking coma. Don't have much time so I will keep this short. Patient presented with a small, less than 1 inch, scratch on his right thigh and severe pain and immobility. On palpation there was crepitus, a cracking sound. We called in a surgeon in the hopes that we could excise the closed wound, but as soon as the surgeon cut the skin the leg deflated. Yes, deflated. The escaped air was horribly putrid in odor. We ordered an x-ray and discovered the leg was simply skin and bones without any signs of muscle. I regretfully informed the patient that we had a strong suspicion of a flesh-eating bacteria called Clostridium perfringens and that the infection was spreading fast. He called his family and loved ones, got a lawyer and said his goodbyes. 12 hours after admission he was declared dead. Where is this bacteria commonly located? My friend's mother was on vacation in Key West and as they were walking down the beach her husband pointed out that the toes on her left foot were all sandy and the other one wasn't. She had been kind of dragging the front of her foot, but only on the one leg. The mom vaguely mentioned that she'd been kind of having a little trouble lifting the front of her foot up, but figured she just strained something from running barefoot on the beach a few days earlier. She went to her doctor to see if she could get some anti-inflammatories. After questions and recommendations to see a specialist, they figured out that she has ALS, Lou Gehrig's disease. This was 6 years ago. Now she is totally unable to move, talk, and breath on her own. All she thought she had was a sprained foot. I thought I had a nasty flu strain. Was feeling generally like crap. Didn't go to hospital until 2 days later. Was in operating room less than an hour after that. Appendicitis. Appendicitis is evil. I thought I had food poisoning. Not a doctor, but I was in a fender bender car accident. I was at fault and my lower back would not stop aching. I went into the ER figuring I had sprained the muscles in my back and that I would be prescribed muscle relaxers and maybe some pain pills. 6 hours, several x-rays, a CAT scan, and 4 doctors later, I found out my spine was broken and, get this, healed. The best theory any of them could come up with was that my spine had broken during birth, and since we never knew, it just healed itself, filling in with cartilage. One of the docs told me that had we known my spine broke at birth, I would have likely never walked and would have been treated as handicapped my whole life. I didn't find out until I was 20 and already had a child. My mom cried because she always thought I was just a really colicky baby, when in fact I was probably in a lot of pain. That's really sad and terrifying. Parental guilt is horrible. Paramedic here. We got called out one Christmas for a grandfather who was tired after eating a huge turkey dinner. We get there and the first responders are standing around outside in high spirits. I walk in, slap a EKG on him. Massive MI, heart attack. Went from happy turkey coma to heart attack in 3 seconds. Frick it. If I'm going to die, let it be after a fantastic Thanksgiving dinner. This one isn't nearly as scary as the others, and I'm pretty late to the party, but here's my story. I have male pattern baldness, and needed a prescription for some hair growth medication from a dermatologist. The doctor said he would give me a prescription, but first wanted to do a full skin checkup, which he does for every new patient. I got annoyed by the fact that I had to strip naked in front of this guy just for hair medicine. A few weeks later I get a call. There was melanoma cancer on my back. They caught it early enough that it hadn't spread. That checkup saved my life. Not my story, but a good one. A guy was involved in a MVA and ended up dislocating his hip. Got him strapped in and taken to the hospital where they ended up popping his leg back in. Now, dislocating your hip isn't very common. The upper end of the thigh fits in like if you were to make a fist with one hand, and then cup your other hand around it from the top. There's also quite a few ligaments and tendons really holding it in there, so when they pop it back into place, there's a significant amount of force holding it in. Anyways, the guy was in pain but conscious during the transfer, and when they got him to the hospital, I forget what drugs they gave him, but he was still making sense and responding appropriately. This changed as soon as they put his leg back into his hip. PT immediately screamed and passed out. He then proceeded to wake up, scream, and pass out again. This happened several times while the doc started to panic trying to figure out what had gone wrong, eventually sending the guy for x-rays. Turns out that his testicle had rolled into the cavity between his hip and his femur, so when they popped it back in it crushed his nut. So, yeah, that turned out to be pretty goddamn serious, I feel. Frick this. I'm at work, I can be writhing in vicarious pain. A year or two ago here in Texas, a woman went to her optometrist for a regular exam. She later told the news after a long silence he asks, "Did you drive here?" Number. The person who drove you here needs to drive you to a hospital immediately. Why? Because you're about to have a stroke. That's amazing but also scary as heck. Imagine knowing the entire way to the hospital. Not a doctor, but my doctor told me if I had waited 12 more hours I probably would have died. So I was taking antibiotics for dental work that had been done, and noticed these weird blisters showing up everywhere. Weird, but whatever. 48 hours later, they started opening up, leaving holes in my skin. No blood, just lost most of the skin in that area. Again, weird, but I was working so whatever. Then they started appearing in my throat, so I got to the hospital ASAP and was diagnosed immediately with Steven Johnson syndrome. Any longer and the layers of my skin would have literally peeled away from each other and I would have died. That was a sobering day. Not a doctor. Sorry, I'm gonna be that guy. After I got my appendix out, I went back a week later thinking I was constipated. Nope. I had a giant butt abscess that had started to wall itself off. They went in the drain it and I woke up in ICU 5 days later recovering from sepsis, septic shock and kidney failure. I saw a 55-ish woman at the ER last year. She asks us if she might have something wrong with her breast. During my exam, I couldn't help but notice that her left breast was bumpy, talking like 5 centimeters mass protruding. The nipple was inverted and leaking blood. Clearly a textbook case of cancer. The woman had a pretty high-paying job and seemed pretty smart, and was clearly in denial. Not a doctor, but this did happen to me. I had gallstones for 3 years or so before I finally got my gallbladder ripped out last year. At its worst, I was getting an attack maybe once a month or so I figured it couldn't be that bad. I went to the surgeon for my post-op checkup. He told me that my gallbladder was filled with hundreds of stones of varying sizes and that it was precancerous. Apparently, people don't typically get gallbladder cancer until they are in their 80s or 90s, and it is often very serious because people don't catch it right away. I'm in my 20s and like I said, I had been sitting on this problem for 3 years before I finally toughened up enough to get it checked out. Scary crap, man. My mother died from gallbladder bile duct cancer. I was on my way to take her to the oncologist when I had my gallbladder attack me for the first and last time. I had that thing removed the next day and it was almost completely calcified. Thankfully not cancerous. My girlfriend is in her final rotations for radiology. A while back a young girl came in after winning a basketball championship. She had some shooting shin pain but wasn't in a lot of pain. Still glowing from the win and talking excitedly about a scholarship offer. When her scan came back, about 60% of the marrow in her tibia was one big sarcoma. Cancer. Surgery and therapy essentially ended her shot at a full ride. I'm not a doctor, but a few years ago I took a positive pregnancy test. I went to the doctor to confirm, just thinking I would be getting some blood work done and maybe an ultrasound. They did the ultrasound but couldn't find a baby in my uterus, so they told me it was ectopic, implanted in a fallopian tube, and I needed to have surgery to remove the baby. I went into surgery and woke up a few hours later. The first thing I remember is seeing my parents and my fiance crying. Turns out I was never pregnant. I actually had a tumor the size of my fist on my ovary and my body was reacting to it like a baby. I had an HCG hormone and everything. I'm 4 and 1/2 years in remission. My aunt fell down some stairs or something in January 2011. It really wasn't serious at the time, we thought. Apparently her hips started not feeling right after that. She went to the doctor about it in the end of July-ish. She had cancer. It was everywhere. She was dead by September. You know, people can go fast sometimes, but we were not prepared for that. Not a doctor, but one night, I suddenly had serious stomach pains. After failing to sleep it off, my parents wanted me to stay home from school, but I declined for I had quizzes that day. I sat through US history, algebra 2, and even tried to eat lunch. Still in agony. So, after finishing my English quiz, I waddled down to the office and called my mom to get me. At this point, the pain is so bad I can barely stand. So my mom takes me to the doctors. Turns out, my appendix was ready to explode. You should have waited a little bit longer. You would have felt a lot better. I'm not a doctor, but this happened to me. I have suffered from chronic earaches and ear pain since I was a few months old. When I was in 8th grade, I was sitting in class when my ear popped, except this wasn't the normal pop that releases the pain. It felt like someone had shoved a red hot metal rod in my ear. Under closer inspection by my pediatrician, who has dealt with my ears my whole life and is one of the few doctors that believed that I was in pain, and he said it was the worst eardrum rupture he had seen. But since I have had this happen a lot, I just took some medicine and went home. Over the next few months my earaches got severely worse, so I went to see an aunt who basically told my family nobody's ears hurt this much or are this sensitive. He is faking to get out of school. After my 5th visit in a month to that end, he suggests a MRI. At least I think that's the big circle thing with the magnets. Ends up that bad rupture had caused the skin in my ear to grab onto the bones in my ear and form a tumor called a cholesteatoma. This tumor was literally eating away at my ear, the bones in it, the cartilage, and was eating into my skull. I went to see a specialist for this, who ended up removing the tumor after a few months and having to completely reconstruct my eardrum and the bones, and a lot of the damage could have been stopped if the original aunt had believed me about my chronic pain. The result in all this is that I have an artificial eardrum made from the muscle in my jaw. They kinda botched that part, I think, because I can't even chew food really with the left side of my jaw after it. And the bones were replaced by the cartilage from the outside portion of my ear. The surgery resulted in bad nerve damage that makes every day a struggle, and I can't hear out of my left ear. TLDR. I had my eardrum burst, which resulted in a tumor that wasn't noticed by a doctor because he thought I was faking. Had the tumor removed, but I lost my hearing and have to deal with pain from the nerve damage every day. My mother was in town visiting for Christmas. Suddenly she was slurring her speech, acting belligerent, and all around confused. Tested her blood sugar and all it said was error. We get to the ear and she passed out. Her blood sugar was a 19. Her liver spontaneously failed. The best the doctors can guess is she caught a virus and it attacked her liver. 4 days after the onset she got a liver transplant. A 22-year-old woman in Baton Rouge, Louisiana gave my mother the ultimate gift. Please, become an organ donor. Please. 16yo here. Got my license like 3 weeks ago. Already an organ donor. My basic thinking is if I'm dead I don't need them anymore. Not a doctor but a nurse. I was working in postpartum care and I cared for a patient who had come into the hospital in labor with her first child. She ended up requiring a C-section. In the OR, they opened her up and found her belly full of cancerous growths. They immediately paged an oncologist at a neighboring hospital. We were just a women's and children's hospital. To come immediately while she was still open. It wound up being terminal. She wouldn't even have known if she hadn't needed that C-section. Can you imagine going to the hospital to have your first baby and leaving with a diagnosis of terminal cancer? I think about her all the time. As a physician, listen to your bodies. You guys know yourselves much better than we will even after talking to you in for 5-10 minutes. If something is going on that is far outside the usual, please come into the air. I would much rather see you and tell you you're fine and worried well, than sick beyond the point of repair and a fool for having ignored your symptoms. Too bad the costs are absurd. Not a doctor either, but this happened to me. About 4 months after I had my son I started to notice a vision in one of my eyes was really off, blurry, spotty, etc. I didn't really think about it much because my eye didn't hurt and wasn't itchy and I had a new baby to take care of. Anyway, it lasted for months and finally my mom and sister convinced me I had to go to the eye doctor for it to see what was going on. I took baby with because I thought, hey, quick apt, maybe 20-30 minutes and I'll probably leave with some eye drops or something. Honestly, one of the worst days of my life. They put me through test after test. I was there for hours. I ended up calling my mom to come get the baby. They weren't telling me anything. They scheduled an MRI for the next morning because by this time my 11 AM appointment had dragged out until 5:30 PM and the clinic was closed. We were the only people there. Still no answers. I am freaking out. Go back the next day and get the MRI done. They send me to the neurologist this time, no ideas today. When I walk in he has all the results from my tests the day before and the MRI I had just taken a while before. I was told I had multiple sclerosis. It was very scary. I worked in a fast track when a mother brought her 8-year-old daughter for abnormal discharge. Aside from the age, this is nothing unusual as we see many complaints like this throughout the day. The mother thought nothing of it, maybe she's on her period. The doctor, however, was suspicious from the start, so he ordered a gonorrhea chlamydia test which turned out positive for gonorrhea. Unfortunately, we had to discharge the patient on the initial day due to some tests, such as cultures, taking much longer to result. But the very next day we checked the results and immediately started calling CPS. The mother was not happy, to say the least. Dad went to the optometrist. She noticed something funky in his eyes, blood vessels. Referred him to cardiologist. 390+% blockages in his heart. Not a doctor, but I was taken to the ER for what I thought was a small infection, even though my arm went numb cold. For some reason I was entirely emotionally distraught and couldn't think clearly. The doctors took care of it, and I ended up not being able to use my arm for a week. Turned out, it was a staph infection, and I was told that if I had waited 2-3 more days it probably would have killed me. Staph. Not a doctor, but a couple of years ago my mother had lump in her breast, so she went to get it checked out for breast cancer. Her mum died of breast cancer and her sister has had it twice and has had her breast tissue removed. Fortunately, however, it was just a cyst. But wait, there's more. Turns out hiding behind that cyst was some early stage cancer. Was easy to get rid of and she's fine now. We had a guy who showed up to the ED with a bad cough. His wife kept saying that she had tuberculosis 20 years ago, and although she was treated at that time she was convinced he had it. His symptoms were far more consistent with pneumonia and he lacked classic TB symptoms. We got an x-ray and sure enough it was TB. Now I have to do several blood tests over the next few months to ensure I don't have TB. Sometimes the patient is right. Another time I saw a lady in the ED with a chief complaint of headache. She basically provided no history and just kept repeating that her head hurt. I tried to get some background, past medical history, etc, but she wouldn't say anything other than my head hurts, give me something for the pain. On her chart she had tons of previous visits for vague complaints and requests for narcotics which all resulted in basically nothing. So I initially thought maybe she was drug seeking, but her behavior just seemed odd. We decided to scan her head and left to go see other patients. I came back a few minutes later and her husband was there now. I asked what happened and he said she was just standing in the kitchen cooking when all of a sudden she dropped to her knees and then immediately complained of a horrible headache. While I was talking to him she began vomiting all over herself. We rushed her to CT and she ended up having a subarachnoid hemorrhage, bleed in her brain. She was taken straight to surgery and ended up being fine after spending about 6 weeks in the hospital. That sounds like tiny spiders bleeding all over her brain. Pharmacy student. One of our first real patient encounters was within a free clinic. Lady gets there, and after going through the routine questions, complains of an itchy foot. Okay, we'll look into that. We were being graded on this by our professors, who were sitting in with us. But we had to keep on task, aka make sure you go in a specific order. So I'm going through this lady's meds, all is well according to her, takes all meds on time. Though she doesn't exactly remember the names of them, a large part of the assignment was to teach us how innocently ignorant some patients are. She's getting her refills on time, seems to check out. I see you haven't refilled your diabetic monitor strips in a while. Are you in need of those? Oh, I haven't used that in a few months. It broke. Oh, well, it's important that you start using that. Skipping some irrelevant talking. Okay, so let's check that foot out. Horrible hygiene and signs of developing necrosis, but caught in time. This sweet old lady had no idea her diabetes could cause such a problem. I thought I had the flu with a bit of a rash. Turns out I had measles and due to sleeping too much I was massively dehydrated. My temperature was around 41 Celsius, and that was sat next to an open window in January. Yay. Vaccinations really do save lives. We got an older patient in the ER because he fell from a stool while replacing a light bulb. The family just wanted him to be checked because he fell on his head. He had nothing. While waiting for the papers, the family started to scream, "Doctor, doctor," when we rushed, and it seemed as if he was having a cardiac arrest. We put him back on the bed, hooked up an ECG. He had an AV block, so the reason he probably fell from the stool was because of the AV block. At first he was such a happy guy and joking around. After we told him what he had, he could only say, "It's in my heart. This means the end is coming." And then BSP, TL, DR came in because he fell from a stool, fell because of a heart condition. And that's why taking a thorough history is so important. Ascertaining that it wasn't a mechanical fall, i.e., dizziness and not clumsiness, might have caused someone to put dots on the second he got into the ED. Poor bugger. Nurse here. I was working a shift in a busy emergency department and a man in his 60s walked in with vague abdominal pain symptoms. After waiting for over an hour in the non-urgent section, he came up to the counter saying his pain was worse. He was calm and polite through the whole thing. Next thing we knew, he collapsed and his heart stopped. Turns out he was having a massive heart attack. We amazingly got his heart going again, and just before we sent him to the cath lab he was sitting up and was as calm and polite as before. Went in for nasty stomach pain. I have PKD, so I thought something happened to my kidneys. The doc said it was just constipation. When I asked for pain meds he said no, and the nurse said, and I quote, "Sorry, you didn't get the diagnosis you were looking for." Woke up the next day, pee blood. Went to another hospital and they saw I had a hemorrhagic cyst burst inside my kidney. I ended up losing half of my blood. Sorry, you didn't get the diagnosis you were looking for. Holy crap. That makes me so mad. I get that there are drug seekers out there, but Jesus Christ, at least feign some kind of compassion. People who were diagnosed with cancer. What symptom made you go to the doctor? I had sporadic stomach pains that felt like gas pain for like 6 months. Even did a video chat with a doctor about it who told me he wasn't concerned because it didn't sound like appendix or gallbladder issue. Some months later pain was terrible one night. Went into the ER and found out I had stage 4 colon cancer. So basically terminal the day I found it at 38 years old. I definitely recommend getting a colonoscopy early or at the very least doing a blood test for C, which is often produced by colon cancer. They found the cancer on my mom's intestine when they did the hysterectomy, which they only did because she was having abdominal pain and kept insisting something was wrong. Finally her OBGYN was like, maybe it's a menopause thing, we can remove the uterus, and then during the surgery they found it. That was a fun post-op visit, and the surgical oncologist on call happened to be an expert in her exact cancer, which is a rare one. So we were very lucky, and she's in remission now. But they would never have found it in time if she hadn't kept insisting that something was still wrong even when they tried to diagnose her with anxiety. This is a lesson I learned a long time ago. I was born with a spinal cord disease, so pretty much the only thing I do is go to doctors. You essentially have to force your doctors to do anything, which is incredibly difficult. I felt a lump in my wife's breast and convinced her to have it examined. Luckily it was relatively early, stage 2, and after surgery and chemo she's fully recovered. The funny thing is, I sometimes think her other breast feels kind of lumpy, but she gets examined multiple times a year now and I'm sure they would catch it, so I figure I didn't really know what I was talking about, and it was only a fluke that I thought it was cancer and made her go see the doctor. Not myself, but my dad. Mostly little minor things that may or may not have been because of cancer, but the big indicator was his rather sudden inability to poop. Within about 2 or 3 months he went from normal to haven't been able to poop in 5 weeks. First doc misdiagnosed him, a month and a half and an ambulance ride later found out he had late stage 3/stage 4 colon cancer. Wasn't a whole lot they could do at that point, but there were things that improved his quality of life for the remainder of his life. They gave him 6 months. He lasted 2 years. The moral of the story is if you can't poop, go see a doc ASAP. Not being able to poop is not normal, and is not okay. Better safe than sorry. Addendum: any change in bowel habit that is not normal for you, go and see a doctor. By the time you get to the not passing anything stage, it's normally because the tumor size is so big it's blocking everything. Glad you got longer with your dad than expected. Had a grapefruit-sized lump forming in my upper thigh hip area. Seeing as I was a naive 11-year-old, I thought it was a hernia or puberty related. Turned out to be primitive small cell sarcoma that spread to my lungs. Been all clear for 13 years now. Just left to deal with the mental aftermath and the potential of aftermath of the high-strength drug treatment I was given at such a young age. Woke up one morning with extreme abdominal pain. Went to the ER and was diagnosed with appendicitis. Had surgery that night to remove appendix and was released from the hospital the next day. A week later my surgeon called me and told me they found a tumor in my abdomen and sent a biopsy to the Mayo Clinic. Was diagnosed with pseudomyxoma peritoni. 2 months later had surgery and chemo to remove the tumor. This was back in 2013. Blood in my poop. Told my doctor. Had a colonoscopy and they found stage IV colon cancer. Been dealing with it for almost 2 years now. I wasn't diagnosed but my mom was. She would get an fever out of nowhere every night but feel otherwise fine and it would be gone by morning. Turned out to be Hodgkin's lymphoma. I've had a fever for almost a week. Please stop. Not me, my dad. He bought one of those stair lifts. Used and after it was installed he fell off it. I'm not sure about exactly what happened, and was injured. He went to get checked for this injury because it kept hurting. They found a tumor in his kidney. Had a colonoscopy pre-op and they found another spot as well. They did surgery for both. Removed the one kidney in full and 2 places on the colon. Neither cancer was related, which is good because that means one had not spread. My dad will be 80 later this month. He is 2 years later and cancer free. He gets regular checkups and includes prior colonoscopies. The only way they might have found this would be a CT scan of the body, which they don't just do. I did recently hear that they don't recommend colonoscopy after a certain age, which I find strange. But maybe it was without family history or something. Think this is assuming you had regular ones before. After 75 or 80 think the thought is as if you made it that far you should be good. They actually brought forward the starting age to 45. I had no symptoms. It was caught on a routine mammogram when it was too small to feel, even by experienced doctors, and it was just below the skin. Get your screenings. They caught my grandmother's tumor when it was the size of a grain of salt. It's amazing what mammograms can do. I had a cough that got progressively worse over a few months to the point I was barely able to talk above a hoarse whisper. X-ray showed a shadow near my lungs. CT showed a softball-sized mass crushing my left lung. Blood work, bone marrow biopsy and PET confirmed non-Hodgkin's lymphoma. Not what I was expecting at 25. But I went through 7 months of treatment and have been in remission for almost 8 years now. I remember singing a song and I couldn't sing loudly. I'm not a great singer, but I remember being in my kitchen and thinking it was strange. It was NHL. I was a month away from my 25th birthday when I was diagnosed. 10 years in remission. I woke up struggling to catch my breath. Went to my physician and was told it's nothing, despite being able to feel a bulge in my abdomen. After another day of wheezing, I got a CAT scan and was diagnosed with stage 4 kidney cancer. It had already spread to both lungs and the other kidney, with the original tumor being the size of a grapefruit and had attached to my aorta. Been cancer free for 15 years now. Good for you for going in for the scan, and congrats on doing so well. Around Thanksgiving last year I had a lump on my neck, and that was the one that made me go in for cancer specifically. For a whole year I had been scratching myself crazy as if I was allergic to air. Had been going to the doctor every couple months trying to figure out what the heck was wrong with me. Night sweats so bad I'd change my sheets every day for a month. A week of no hunger at all towards about when the lump showed up. Never weighed myself, but I dropped down to 120 pounds apparently. It wasn't until that lump showed up that everything clicked. I had Hodgkin's lymphoma, blood cancer, stage 4. Obviously I'm alive, but they don't call you cured till you've gone 2 years without a problem. A year and some to go till I'm cured. My mom had back pain. When investigated, the pain was referred from her liver, which turned out to be a metastasis on the liver from primary lung cancer. Referred pain is a B. My tooth pain is linked back to my heart. It's weird as all heck. Not me, my ex-boyfriend. He had a UTI that wouldn't go away. Scans revealed non-treatable cancer throughout his major organs. Can't remember the name of it, but it was very rare. He had surgery, chemo, radio, the works. Died less than a year after being diagnosed. He was 21 and the healthiest person I've ever met. I'm so sorry. Only semi-relevant as it wasn't cancerous, but the symptoms were caused by a primary tumor. It started with I thought were weird migraines. In addition to headaches, I just randomly vomit with only about 2-3 seconds warning and occasionally get really intense deja vu like sensations about memories I knew couldn't possibly real. Later, this progressed to full tonic-clonic seizures. I had knee pains. Started in my right knee, then my left. Had X-rays done. They found nothing. Then pain started in my hip and to my back. More X-rays. The doctor noticed a spot. Had a CAT scan or MRI down. Don't remember in that when they noticed the tumor on my spine. Found a lump just above my collarbone. Only found it by chance when I woke up with a bad neck. In hindsight, I'd been suffering with crippling fatigue, no energy to get off the couch, sleeping for 9 hours and waking up as if I'd never had a sleep, napping for 2-3 HRS at a time. Turned out to be stage 2 Hodgkin's lymphoma, unfavorable due to the spread in my lymph nodes. I'm halfway through treatment and responding well. If in doubt, always go and get checked out. I got out of the shower and was drying my legs. For a few weeks I felt pressure around my throat, but this time it was immense. Looked in the mirror and my face had turned blue. I had an 11 cm tumor putting pressure on my throat and my arteries. I'd had breathing problems and itching and sweat night and daytime for weeks. B-cell stage 4 NHL. 10 years later and I have another child. They said I never would and I'm okay. Can I answer for my brother? He's no longer with us. It was his weight gain. 2 doctors in the state of Oregon said it was a thyroid problem. The third in Maryland, USA, finally did tests and confirmed it was, indeed, cancer. He was hungry all the time, which wasn't normal. He also began talking about coffins, burial plans, and heaven. Again, not normal. Sadly, they weren't able to do much, but now we can educate others. If you ever feel swollen, sore, or hurt in your lymph nodes, or begin gaining weight randomly, it's better safe than sorry. My left leg just kinda was bugging me a little. Then it kept doing it for a few years off and on and I never thought much of it. Then when I was 19 the same leg was bothering me in the same spot and suddenly that pain went from bad to worse. It was Halloween of 2019 and I was doing rounds at my college. And all I did was step to open a door and a very sudden and sharp pain occurred. It started to get better but the what and why just made absolutely no sense to me. So I went to the doctor to have it scanned. Turns out I had Chondrosarcoma, cartilage cancer, in the proximal, outside, portion of my femur. The tumor was roughly the size of a Nerf football. The reason the pain had started to get worse was because the bone had become so porous and gapped due to the cancer destroying it that it was starting to fracture. I ended up having to get a biopsy and not even a month later a hip replacement. I ended up living though so far. Moral of the story: sometimes check into those little annoying pains. I didn't even know there was such a thing as cartilage cancer. December 2015. My dad passed out in the middle of the day. Luckily he was in public and not alone at home, and some people called the ambulance. 2 days at the hospital and it's clear, lung cancer that has already spread into multiple other organs. The 1st of October 2016. Died in the middle of the night. Coughed up a ton of blood. Tried to reach the phone to call help. Fell and cracked his head open. I'm so sorry. Warning: NSW. Blood in my semen. Doctors thought it was a common infection which is known to cause that problem. I did antibiotics 3 times and it didn't work because, well, I didn't have an infection. Eventually it stopped happening, so we figured it must have fixed itself and decided to just be happy with that. Then a few weeks later I felt a mass growing near my groin. My doctors thought it was a cyst and set me up with an appointment for a general surgeon to remove it. They sent samples to the lab and turns out it was cancer and it was causing internal bleeding, hence the blood in the semen. Lesson here is if you have blood in your semen, maybe don't let it slide even if it goes away on its own. Been cancer free for about 4 years now. Not me, but my mum had a sore hip for a couple of months. She tried physio, chiro, acupuncture, etc. Eventually I convinced her to see a doctor and get a scan. By then it was too late. She had stage 4 lung cancer, never smoked in her life, which had metastasized and spread throughout her bones. She got lucky and put onto trial, so we got to keep her for 2 years, otherwise she would have had 2 months. My dad has a little blood in his urine. Then one night he couldn't pee. A visit, emergency surgery, stage 4 bladder cancer. I freaking hate cancer. About a decade ago doctors found a spot in my grandpa's lung. At the time, they told him it wasn't anything to worry about. As time went on, his breathing got worse and worse and he got bronchitis all the time. Eventually he went back in and they found that the spot was bigger. It was lung cancer. Last July, I had a lymph node on my neck that swelled up. An ultrasound, CT scan and biopsy were all inconclusive. No one could see anything. Finally got to see an ent and he put a scope down my throat. Within seconds, he told me there was a growth at the base of my tongue and it was probably cancer. That was a tough call to my wife from the parking lot. We thought he was going to tell me everything was clear, although in retrospect I'm not sure why. A biopsy and a PET scan confirmed it. The ent removed the tumor with a surgical robot last September, and I completed radiation therapy a year ago. My 1-year PET scan was clear, which was great news. Now I'm staying vigilant and hoping that everything stays clear for the next 4 years. Not me, but my mom. She was feeling tired all the time and noticed when she ate steak she felt great. Skin started turning a bit yellow. Went in to run tests. She has type 2 diabetes, and her doctor called her and said she had a hospital room waiting. Do not wait, get there immediately. She had AML, acute myeloid leukemia. She passed away 2 years later. Fun fact, they don't tell you that even if you beat AML, which she did, she was in remission. They have only around 5 years to live. AML is a horrible thing to watch someone go through. I miss her every single day. My Sil was 12 weeks pregnant, Became short of breath. Went to hospital where they intubated and put her on ventilator. Diagnosed with AML. She hemorrhaged and died within 36 hours of admission. She was 29 years old. Thanksgiving 2013. I went to the bathroom and was peeing dark red blood. Went to the emergency room and they ran a bunch of tests. Told me I had a bladder infection and stage 4 kidney cancer. It had already spread to my liver and lungs. They told me I have 2 years left to live, removed my kidney and the tumor, and put me in a trial treatment program involving stem cells. Now I have no detectable signs of cancer. That's great news. Not me, but my mom. She was having pretty bad GERD, which ended up being unrelated to her cancer, but they did an MRI to see what was going on and they found a small mass in her lower right lung. She had some symptoms too, a cough and some pain. Turned out to be small cell lung cancer, limited, thank God. She just finished her last round of chemo yesterday. She gets a scan next month to see if the treatment is working, then it's radiation therapy. Not me but my mom. She went to the ER for what she thought were kidney stones. She had had kidney stones before and the pain she was feeling was pretty much the same. What it turned out to be was stage 4 lung cancer. No, she wasn't a smoker and never lived with a smoker. And a tumor had formed around her spine, eating away the vertebra and putting pressure on her spinal column, causing the pain. Other than that, no other symptoms. I went to see a urologist because of recurrent UTIs. He prescribed an ultrasound to check that nothing was causing these UTIs, such as a microfistula, which revealed a lesion the size of an egg on my left kidney. He asked for a CT scan so that he could have more details about this lesion, and it turned out that after the CT scan the radiologist strongly advised me to contact my urologist quickly. I had a carcinoma that was starting to make polyps and the next step for the tumor was to start spreading. I had my kidney and part of my adrenal gland removed and didn't even need to do chemo since everything had been removed. The pathologist confirmed that everything had been removed, but no symptoms, which is why kidney cancers are discovered incidentally and very often at an advanced stage, or they are discovered when they start causing symptoms, which is often too late. Just doing an ultrasound every now and then would help to avoid reaching the stages where nothing more can be done. Not me, my mother. She developed jaundice, was diagnosed with liver cancer 5 days later. Took her life 9 months after the diagnosis. Love you mom. Miss you every day. I'd had what I thought was a persistent stomach bug, but started noticing really dark stools and dark, almost brown, urine. Went to doc and he put me on liquid diet for a few days to clear it up. A couple of hours later I went jaundiced, and went in again the next day, after tests to rule out Hep A. I went in for several imaging studies and ended up being diagnosed with bile duct cancer at stage 3B. It's extremely rare, fewer than 8,000 a year worldwide I think, and aggressive, less than 10% 5-year survival rate, and typically doesn't set in until the 60s, with no apparent cause other than bad luck. I was 37 at diagnosis, but just turned 40. Physical scars notwithstanding from 2 abdominal surgeries within 5 days. One a partial liver resection and some other work under the hood. The other an emergency surgery to clear an abscess and do more work under the hood caused by said abscess. Plus about a dozen other smaller procedures, and you'd never be able to tell what I've been through. Constant squirts, then constipation. Frustrated me enough to offhandedly mention it to my neurologist. Surgery 9 days later to remove a huge tumor. Stage 3 colon cancer. 22 years ago. Back when I was a baby, my dad noticed that in pictures of me there was something off with my eye. Instead of having the red dots over my pupil, it would only appear over one. They took me into a doctor just to see what was up, and immediately after looking into my eye sent me into surgery the next day. It turns out I had retinoblastoma, which already at that point blinded my right eye and was close to blinding my left. They removed my right eye and froze the tumor behind my left eye. Thankfully I only have permanent vision loss in one eye instead of both. I have heard of that diagnosis tool. It's amazing your parents followed up. Glad you're still with us. My brother had a persistent cough and felt tired. We had a family trip to Ireland planned, so my mother insisted he go to a doctor before the trip. Lung cancer. His first chemo round was the week before the trip. He was cancer free for a year after the chemo, but then the cancer came back. He couldn't tolerate more chemo, and he passed away shortly after his 52nd birthday. Smoking kills. My mother had persistent nausea and vomiting that she attributed to a nasal drainage issue that she has had for most of her life. Then she started itching all over and nothing seemed to help. Finally persuaded her to go to a doctor and realized she was jaundiced when I got her out in the sunlight. Pancreatic cancer, with the tumor obstructing her bile duct. Stage IV, with spread to her liver, so no surgery options. We are 6 months into chemo and her tumor numbers are climbing again, so we are just focused on getting through each day. I'm sorry to hear. In addition to having my own issues, I lost both my parents to cancers. My mom's battle was incredibly short, which I sometimes think was a blessing. Hang in there. I got a scan to investigate persistent pain around my coccyx and lower right abdomen. The scan revealed a tumor on my appendix. After 2 surgeries the cancer was gone, but the coccyx pain continued and turns out to be a completely separate condition. If I didn't have that non-cancer condition, it would probably have taken a few more years to discover the tumor and I'd be dead instead of posting on Reddit. This is my father's story. He went to the hospital to get a lymphoma removed from his shoulder, and as the doctor was wrapping up the appointment, ready to send him home, the nurse spotted a concerning mole on his back which the doctor had missed. Turns out that nurse's attentive eyes saved his life, as the mole pathology report revealed it was a malignant melanoma that could have cost his life if found any later. They removed all nearby lymph nodes and luckily the cancer hadn't spread to them yet. Now he has scheduled checkups, though he is declared cancer free. Went to the ER with something different. Randomly had a CT scan, and they came back with, by the way, this thing came back, really small, and might be nothing. Have a doctor check it out the next time you go in. No rush. Stage 1, really small, almost didn't qualify for the biopsy. So far so good. Post-surgery and radiation, just losing some hair. My wonderful 4-year-old daughter was not planned, but thanks to her, I decided to have a vasectomy. I had always had one slightly enlarged testicle due to a mountain biking accident 10 years prior. My urologist had it biopsied because it didn't look right. Turns out I had had testicular cancer for an impossible to determine period of time. 4 rounds of chemo later and I'm perfectly fine. Had I not had my daughter, I would have probably had much worse results years later when it finally made its presence known via pain and had spread into my body. So my daughter technically saved my life, which is knowledge I'm sure she'll use on with great glee during her teenage years when I'm trying to punish her. As a med student reading all this comments about people experiences with doctors dismissing their concerns repeatedly has been very insightful indeed. I'll definitely remember these comments when I get to my practice and not dismiss any patient's concerns. If I may speak for my father, our country has pretty good population screening for different cancers. My dad received a colon cancer test kit in the mail. He took it, sent it in, received mail back that blood was found in his stool he sent in. Just before Christmas 2019 he saw an oncologist in the hospital. Right in the first heat of COVID he had all his tests done. Turned out it indeed was cancer. Due to COVID his operation to remove part of the colon was diverted and cancelled multiple times. Half a year later he could finally get his surgery, and for the last 1.5 years, he has been clean. Not my experience but my dad's. He had this cold that just wouldn't go away. Stuffy, plugged up nose. He went to his primary care doctor who examined him. Told him he had a deviated septum, which was weird because he has never had that. Sent him to imaging and found a brain tumor. More tests found multiple myeloma. He passed 5 years after diagnosis. He was 55 when diagnosed. Stage 3 rectal cancer. My first symptom I can recall was having diarrhea every morning, usually just once after I woke up. Eventually it became an all-day thing and I started having pain in my butt muscles after sitting any length of time. I thought I might have IBD. Cancer never crossed my mind. Woke up from my colonoscopy and the doctor said I had a huge tumor and would need chemo and surgery. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.